Thank you very much for that introduction, and thank you very much for the privilege of the podium today. I will be presenting on the impact of age on morbidity and mortality following bariatric surgery. These are our disclosures. The population of the United States is continuing to get older, and predictions say that 20% of the United States will be greater than the age of 65 by the year of 2030. With this, we're seeing increasing rates of obesity within the United States as dictated by multiple studies. A Cochrane review has shown that bariatric surgery shows improved outcomes over medical therapy for weight loss and obesity-related comorbidities. The study of age in bariatric surgery is one that has been looked at previously. However, no concise definitions have been utilized in the literature. Some authors use different age ranges. Some only look at gastric bypass, while others only look at sleeve gastrectomy. And thus, it's uncertain how age affects the outcomes of bariatric surgery. We aim to utilize the MBSAQIP to determine the impact of age on outcome for patients undergoing bariatric surgery in the form of routine laparoscopic sleeve gastrectomy and laparoscopic Roux-en-Y gastric bypass. The MBSAQIP is a database that we utilize for retrospective analysis from 2015 and 2016 databases. It collects data from 791 different MBSAQIP centers, and in this database for those 2 years, there were 355,675 cases. The benefit of using a database of this nature rather than something like NSQIP is that it contains bariatric-specific perioperative information. In order to help us analyze the data, we constructed combination variables. Because of the vast number of patients, most categories are statistically significantly different. Thus, we constructed a comorbidity index, which included factors such as GERD, mobility, MI, previous cardiac intervention, hypertension, COPD, diabetes, functional status, smoking, OSA, and a BMI greater than 50. And as shown, we constructed similar variables for surgical site occurrences as well as major complications. We constructed 4 different age groups. Young adults were classified as 18 to 44, and this was our control group. We then stratified age at 45 to 54, 55 to 64, and greater than 65 years of age. Our exclusion criteria are on the screen on the right, and these were excluded in order to identify what we considered routine bariatric surgery. And we performed univariate and multivariate analyses. These are our overall patient characteristics. As you can see, there are roughly 280,000 cases that we analyzed, with 29% of them being Roux-en-Y gastric bypass. As one would expect, there were differences between the overall outcomes between Roux-en-Y gastric bypass and sleeve gastrectomy, with increasing age in Roux-en-Y gastric bypass, as well as increasing BMI. And these patients tended to have a higher comorbidity index. When we observed the operative characteristics between Roux-en-Y and sleeve gastrectomy, we again saw many differences, including increased operative room time, increased rates of major complication, as well as a small increase in rates of mortality. We then looked at our database based off of age, and we looked at the differences between patient characteristics. We saw that with increasing age, as shown by the yellow line here, there was an increasing comorbidity index. There was also a decreasing percentage of female patients in the older age cohorts. BMI was statistically different, but relatively clinically similar between the age groups. And there was an increasing rate of GERD seen in the older age groups. We then analyzed our outcomes by age. And what we found was that there was an increasing rate of major complications as age increased, an increasing rate of readmissions as age increased, as well as an increasing rate of discharge to a facility other than home. The differences between surgical site complications and 30-day mortality were statistically different, however, not clinically different. There are obviously going to be differences between the patients of increasing age, and so in order to control for the potential confounders, we performed a multivariate analysis. And The first line I'd like to direct your attention to is the comorbidity index on the bottom. As you can see, comorbidity index was independently associated with all of our outcomes of interest, including major complications, surgical site complications, reoperation, readmission, and mortality, which makes sense. More comorbid patients are more likely to have complications. However, even when we controlled for the factors in the comorbidity index, as well as BMI, gender, and race, we saw that age had an independent association with a higher odds ratio than comorbidity index did in the categories of major complication and mortality. Interestingly, patients of age 45 to 54 and 55 of 64 were protected against readmission. This data here is for all cases. However, we saw a similar trend when we stratified the data by just Roux-en-Y gastric bypass as well as just sleeve gastrectomy. So in conclusion, based on our study, patients at age 45 and older are at increased risk for morbidity and mortality in both laparoscopic sleeve gastrectomy and laparoscopic Roux-en-Y gastric bypass. There are decreased complications seen in the sleeve gastrectomy group, and this was true across all of the different ages. And so finally, in summary, the delay of weight loss surgery may come with the increased risk of procedure, and thus these patients who qualify for bariatric surgery should be referred to a surgeon at an appropriate time. Thank you very much, and I'm happy to take any questions.